our public policy and also to our participants. We are delighted to join with you today. I am Dr. Kathleen Reed Martinez, and I serve as the Dean of the Geneva Institute for Leadership and Public Policy. And I join with my other colleagues in thanking you for joining with us for this important Zoom conference. Today, we are indeed facing the reality of dealing with the aftermath of a pandemic that has swept the globe. It has shattered families, it has shattered communities. It has turned nations into upside down as they've asked questions, and as they've wrestled with what should we do in order to meet the critical healthcare needs of our communities. We see the needs of our citizens. Sometimes we've stood helpless, wondering how would we get the help that we need in order to make the changes. But yet somehow changes did occur, help was brought. There has continued to be, though, the challenge of how can our healthcare systems be expanded? How can they be stretched to the breaking point, and yet we have to stretch them further in order to make this happen, to take care of the people. In the midst of this situation, not only were the nations dealing with the healthcare issues, but the economic impact was humongous. Indeed, businesses were going bankrupt, people were jobless, and the challenge of what to do became a resounding. But this has been true, especially the challenge of caring for the most vulnerable within our population, indeed, the poorest of the poor. We believe that in the midst of these tragedies, that it has been possible for many to find ways through. And indeed, you'll be hearing from our panelists today who've been able to move forward. They've been able to advance opportunities to support and care for those in need in the midst of the COVID health crisis. Helping others is indeed what we are all about here at the Geneva Institute for Leadership and Public Policy, and with our mother institution, the Global Hope Network International. We believe that all together, as we link together and share knowledge and information, that we can come together to help find solutions. So today we'll be looking at different groups who have found the strategies to develop transitional public policy that can help their nations and your nations move through and help the vulnerable populations so that they're not just surviving, but they can actually reach the point of thriving as we all wrestle together with the aftermath of the challenges of COVID-19 pandemic. The Geneva Institute for Leadership and Public Policy was established to bring hope to nations. As GILPP, as I mentioned earlier, works with Global Hope Network International to help transform nations toward prosperity and liberty. The vision for GILPP is to promote public policy created by enlightened and compassionate public leaders. The role and principled international initiatives of this institute is to offer an intensive workshop such as this on critical contemporary global and national issues. Unfortunately, we could not meet in Switzerland this year as we have in the past due to the COVID restrictions, but we do plan to return to the city as soon as possible for our future summer conference, since Geneva symbolizes the important role of good public policy to transform a community and transform a city such as Geneva that has become known for its respect for human rights. That aligns so beautifully with the Geneva Institute for Leadership and Public Policy's goal and mission. In addition to this, the workshops that we offer not only in Geneva, but we offer them around the world. And GILPP joins with its founding institution, GHNI, and to enjoy the special consultative status with the United Nations Economic and Social Council in New York, Geneva, Vienna, Austria, Kenya, and Ethiopia. The work of GHNI and GILPP cares for the most disenfranchised and most vulnerable in our societies. So we are delighted to provide you today with a program on transitional policies for poverty alleviation, thriving during international crises. I trust this program will be of benefit today. This desire to help the poorest of the poor, the most vulnerable, was only a dream a few years ago, but today we at GILPP are here in the midst of a global pandemic. This program rides on the shoulders of our colleague, friend, and fearless co-founder, the Honorable Hal Jones, who worked tirelessly over the past decade to see Geneva Institute for Leadership and Public Policy become a reality. You will hear today from his wife, Lana, as a co-founder, the two of them, the hours that they spent to bring to fruition what was near to their hearts. Tragically, our friend Hal passed away this past fall, as we all were working together to bring today's program to fruition. Hal would be proud of us and our perseverance through the global health crisis caused by the coronavirus. Indeed, we do wish that he were here to celebrate the program, which is a culmination of his work over the years. Hal lived the values-based leadership that we will be discussing during our 2 days together. And because of his commitment to integrity and transparency, and his compassion for the poorest of the poor, we have the ability to respond today. Indeed, we stand on his shoulders to continue the work that he began. Again, thank you for joining us for this important topic. Today, we will have Medhat Eskandar as our Director of GILPP and also the COO of Global Hope Network International, who will serve as our moderator. Medhat?
Thank you, Dr. Martinez. Ladies and gentlemen, good morning, good afternoon, good evening, wherever you are on this day. I'm pleased to join with Dr. Red Martinez in welcoming you to this high-level 2-day event, jointly organized by the Geneva Institute for Leadership and Public Policy, GILPP, and the United Nations Institute for Training and Research, UNITAR. I would like to thank our long-time partner, UNITAR, for their ongoing support in organizing this international conference. I would also like to take this opportunity to express my deep gratitude to all our distinguished speakers. Our presenters today come from a variety of perspectives and nations, including Latin America, Europe, Africa, and the Middle East and South Asia. During this 2-day event, we will cover important topics that will help you in developing transitional policies for poverty elimination. Topics we will range from human rights to the important role of civil society. On the journey, we will take a look at a number of case studies. Today, we will begin this journey with an overview of the United Nations commitment to human rights, follow with health challenges and responses during the COVID-19 crisis. This will followed by a look at the food challenges that are occurring in the midst of the pandemic and the broader concern for economic stability. But before we proceed with the program, I wish to honor the legacy of Hal Jones, the co-founder of Global Hope Network International and GILPP. I feel incredibly thankful for his vision that continues to inspire all of us. We miss him. Today, we have the privilege of hearing firsthand from Lana Jones, who co-founded GHNI and GILPP with Mr. Jones. Mrs. Jones serves on the GILPP Executive Committee and GHNI Geneva Board. Mrs. Jones is also a graduate of the University of Hawaii, worked closely with her husband, assisting in the very successful real estate as a trainer, acting as a campaign secretary when he ran for political office and won. So, Mrs. Jones, the floor is yours.
Greetings, Kathleen, Medhat, and distinguished guests. It gives me great pleasure to share with you the vision that my late husband, Harold Hal Jones, had for the Geneva Institute for Leadership and Public Policy. After merging our real estate company with Coldwell Banker Real Estate and then retiring, we founded a small Swiss non-government organization called Global Hope Network with the mission of bringing help and hope to the hidden and hurting. As the organization grew, it became Global Hope Network International. Before this, Hal served 3 terms in the Hawaii State House of Representatives. As a freshman legislator, he was privileged to attend the American Legislative Exchange Council, where they taught him how to write good public policy to benefit his constituents. During his second term in 1986, he was awarded Outstanding State Legislator of the Year by the same council. As Hal and I traveled to the many countries that Global Hope Network International serves to try to eliminate poverty, we saw the need for the leaders of these countries to be able to put in place good public policies to help their people and countries to thrive and prosper. Hal knew how valuable the training was that he received from the council and wanted to provide this training for policymakers who truly want to see their countries progress. Thus, the first Geneva Institute for Leadership and Public Policy was held in June 2010, 11 years ago. Each year, the Geneva Institute for Leadership and Public Policy seeks to gather together experienced leaders and policymakers around a central theme to share their wisdom, experiences, and best practices with those who want to learn how to best help your people and your countries. Hal also wanted to leave a legacy of making the world a better place for our children, grandchildren, and great-grandchildren. He wanted them to know the values and principles that he based his life upon by transforming for the better the society in which they live. He believed that every father and leader would also want to leave a lasting legacy for the generations to come. May you all find inspiration and encouragement to this end through what is shared today and tomorrow. By the way, we are celebrating the 20th anniversary of Global Hope Network International in September via a Zoom celebration, where we will be sharing our history and before and after examples of the work we are doing in various countries. If you would like a link to join us, please send me an email to lana.jones@ghni.org. Greetings, Kathleen.
Thank you. Thank you very much, Mrs. Lana. And thank you for letting us share this amazing vision and this journey with you. And thank you for working tirelessly to help all of us at GHNI and GILPP to do a better work. Thank you so much. Now, our next distinguished speaker and partner is Honorable Alex Mahia, Director of the Division for the People and Social Inclusion at the United Nations Institute for Training and Research, UNITAR. Mr. Mahia, he has more than 20 years experience working at the highest levels of public sectors and international affairs. He has served as Vice Minister of Economy of the Republic of Ecuador. Mr. Mahia is going to speak on the topic of human rights and the role of the law. And thank you so much, Your Excellency, to be with us today. And please, the floor is yours. Welcome.
Thank you very much, Mr. Iskandar. Before I begin, I would also like to pay my respect and remember our late friend, Hal Jones. It is a great privilege that we can hear today from the other co-founder of this beautiful organization, the mother organization actually of GILPP. And to Mrs. Jones, I would like simply to say that it's quite an honor for us to continue on the legacy of her late husband and herself. We are committed with the same vision and we are here to support it. Having said so, allow me now to share a short presentation to hopefully give UNITAR's perspective on human rights and the rule of law as part of this important conference on transitional policies for poverty alleviation, thriving during international crisis. Next, please. My first boss at the United Nations, the late Kofi Annan, also a resident of Geneva that departed last year, used to say that we often mistake stability in terms of security and economic activity to mean a country is doing well. We forget the third and important pillar, rule of law and respect for human rights. Without that, no matter how secure or how developed in economic terms a country is, it is not complete. Next, please. Now, I wanted to put in perspective when we talk about crisis in plural with an E, in particular this crisis with an I, the coronavirus pandemic. I wanted to see exactly where we are, and I do know that there are other speakers that will be telling us a lot more than that. But just so we can remember the 3.7 million people that have already passed away because of this virus, and the 173 million people that have been infected with coronavirus. There you see, these are the numbers and the graphs from the World Health Organization. I'm speaking to you from the Palais des Nations in Geneva. The World Health Organization is literally down the road 3 blocks or so. There you see the waves that we have seen, that we have experienced, and we have not finished this thing. It is a long way to go. So from that perspective, you will get to hear what I'm going to say. Next, please. What is the potential impact of COVID-19? It is, of course, on public health, as we know, but also economic, as we also have seen, and social and political. If you read with me at the center of this slide, we have to remember that in 2020, it was assumed by the World Bank that 120 million people descended into poverty. They have already been uplifted in their socioeconomic status and their income, but then the coronavirus and its unemployment impact made them go backwards. If you see at the end of the paragraph in the center, the first paragraph, the World Bank also expects that 150 million people will be in extreme poverty, new people. These are additional numbers by the end of 2021. But how many poor do we have in the world? And you see that it depends on the statistic, but it will always be around 10% of a total of 7.7, 7.8 million people. That means that people living with less than $1.90 a day are in close to 800 million, more than 770 or 780 million. If you understand that poverty indeed is more than just having low income or no income, you perhaps will find interesting what we call the Global Multidimensional Poverty Index, or MPI, that the UN publishes every year. You will see the difference in the numbers, because in 2019, we at the UN assumed that multidimensional poverty was 1.3 billion people, not 780 or 800. And multidimensional poverty, which is something that the Global Hope Network International really tackles and makes a difference in, is, for instance, not only that you will be making less than $1.90 a day, but also that you don't have adequate housing, adequate education for your children, adequate health, and so on and so on. If you go to the left of this slide, we all know the vertical bars, the blue one, that this public health crisis is taking 1 or 2 years. Hopefully with vaccination, it will be put in the past in a few months. But the red vertical bar says that the economic, employment, and financial crisis will take between 5 and 10 years for us to recover. And the orange bar is the worst. It shocked me the first time that I read it, and I wanted to make you think, hopefully understanding that the polarization and insecurity and the bigger north-south divide can take indeed a generation, regardless of how you measure it. 20 years, 30 years, we don't know. What we do know is that this polarization and insecurity and this divide is even bigger today than what it was 2 years ago. Next, please. I would like to put together these two topics, human rights and rule of law, from the perspective of the Sustainable Development Agenda, what we call Agenda 2030 at the United Nations, something that we must remember does not belong to the UN. I do represent the United Nations here, but I have to say that there are 193 member states, 193 governments that have made these goals their own. In the General Assembly of September 2015, all of them, presidents, prime minister, ministers of foreign affairs, signed committing to actually adopt this as a roadmap for public policy and the fight against poverty until the year 2030. There are 17 goals that I'm sure you know, but if not, I am inviting you to just Google that, Sustainable Development Goals, and you will see why we believe, hopefully, that this is a holistic approach to tackle the well-being of the citizens of this planet. Next, please. Out of those 17 goals and 169 targets and 231 indicators, because we have to measure if indeed we are advancing or not, and what happened in 2020 when we went actually backwards, and this year perhaps the same. But out of the 17, if you remember what 16 is, we need to quote it here. It postulates to promote peaceful and inclusive societies for sustainable development, to provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. Target 16.3 within this goal says that we must promote the rule of law at the national and international levels and ensure equal access to justice for all. But what do you need to ensure rule of law? Next, please. You need institutions. And institutions, from our perspective, and there are several scholarly approaches to this, but most of them will agree, the importance that national governments will have proper institutions, a real civil service, and a less politicized apparatus. So indeed, the republic or the country is not recreated or refounded every time a new administration comes in. So SDG 16 on peace, justice, and strong institutions, again, if you go to target 16.6, postulate that we must develop effective, accountable, and transparent institutions at all levels. And if you go to target 16A, we need to strengthen relevant national institutions, including through international cooperation for building capacity and so on and so forth. So international cooperation is important. No government is isolated on its own. And we all must understand why the rule of law comes when you have adequate justice systems, but also the right level of institutionality in a country. Next, please. Let's try to understand the reality on how people actually perceive what we are talking about. The WJP Rule of Law Index 2020 give these numbers that are rather preoccupating. Factors of the rule of law over time, the quality of government, the level of corruption, how open is the government. Sorry, so someone needs to mute himself or herself. Thank you. And so on and so forth. In all these indicators that you see on the screen, what you can perceive when it goes down is the percentage of change with the last year when it was improving, or the other side when it was going backwards. And then you see in the stripes, the bars with the stripes, what was the average in the last 5 years. So we need to do better. That's what the reality, the perception of the people actually tells us, that we need to improve the way we manage government, we administer justice, and perhaps we fight corruption. Next, please. So in this differentiation, perhaps, on human rights and rule of law that we need to assess here today, To the left, allow me to say in a very, very succinct manner that human rights, as we most know, is a concept that is well defined. They are part of the jargon of the common lexicon of people today. Human rights are established in international standards. The UN is a custodian of them. We host here at this Palais des Nations, at this Palace of Nations in Geneva, the headquarters of the actual Human Rights Council, the global entity that meets here several times a year. And human rights are also, they do have a robust monitoring and evaluation mechanisms. But if you go to the right, rule of law really don't have a global adopted definition, a globally adopted definition. There are several, but we need to get to where we are with human rights. Rule of law are rooted in domestic national law. That has some pros and cons that we will discuss later. And rule of law are non-existent independent monitoring and evaluation. They don't have independent monitoring and evaluation as we do have for human rights. So having said so, still, rule of law is the foundation for all human rights. Next, please. Another vision of the reality from the WJP Rule of Law Index 2020. Overall rule of law score changes year after year. The biggest improvements and declines in overall rule of law by region or by country as of last year. So you see the bottom in the horizontal bar, the more you go to the right, the better, right? So the red or the orange, not good, and the yellow, lukewarm. So rule of law really needs to improve globally, but there are indeed countries that require a better examination and more transformation when it comes to rule of law. Next, please. How do we make the law work for everyone? You know the principles. Allow me to go one by one and to simply make you think, if I can invite you to do so, on why this is important. The principle of supremacy of the law, the principle of equality before the law, we are all equal, the principle of accountability to the law, and the principle of fairness in the application of the law. Without these rules, there is no real justice. Next, please. Now, we are trying to have this conversation, understanding how to thrive within a crisis. And the crisis that occupies us today is, of course, the coronavirus crisis, as we just saw. What has it been, the impact of the COVID-19 crisis, in terms of inclusion? And I will tell you the responses. 62% of people responded to the following question in the manner that you will see. The pandemic deepens inequities around the world. Those with less education, less money, and fewer resources are being unfairly burdened with most of the suffering, risk of illness, and need to sacrifice due to the pandemic. 2/3, 62%, 2/3 of the world agreed. And here you have just a summary of the answers. This is coming from the 2021 Edelman Trust Barometer. Next, please. Rule of law and human rights. Turning the idea of human rights into reality requires a lot of work, and it is indeed possible, but it will take us a concerted effort. Remember that the preamble to the Universal Declaration of Human Rights says, it is essential, if man is not to be compelled to have recourse as a last resort to rebellion against tyranny and oppression, that human rights should be protected by the rule of law. This document was redacted or conceived in part by someone that I admire, Dr. Charles Malik from Lebanon, the chairman, the president of the conference that actually drafted and brought to fruition the Universal Declaration of Human Rights in 1948. Dr. Malik, I admire him because I'm of the Christian faith, and this is very important in my life, and he was a committed Christian. He took some principles from the Bible to influence the way the Universal Declaration of Human Rights was crafted. But I tell you today, no matter how what faith you come from, or from where you come from today, no matter what you believe or not, there are these basic universal principles that humanity will have that should guide us in this quest, again, to understand that beyond human rights, we need to protect the rule of law. Next, please. Here you see in this allegory, graphic allegory, that the rule of law needs to have some balance between ensuring human rights and how people exercises authority and power. Power cannot be in the hands of an autocrat or a single person. There has to be check and balances, and we have to make sure that we take the rotten apples from that community. So if you go to the next one, Julia, thank you. You will see that we have a crisis of confidence. At the end of the day, power is exercised by individuals. And it is important to remember in this conversation about rule of law and human rights that the quality of leadership, that how governments are managed, is very intrinsically important. This also comes from the 2021 Edelman Trust Barometer, and basically is to understand how trust in all information sources are at a record low in 2021. You see the trajectory in the last 10 years, and what happens nowadays, according to what people are telling these surveys, people believe more search engines than the traditional media or all media or social media. How can it be? But it is. Next, please. Another way to understand the crisis of leadership and trust that perhaps we are experiencing is to understand that societal leaders are not trusted to do what is right. And you see the bars, again, from the 2021 Edelman Trust Barometer. To the left, very, very preoccupating. The lowest credibility goes to government leaders. I have been a senior government official, which was a great privilege in my previous career, and now a senior official at the United Nations. I can tell you in all humility that unless this changes, all of us are good for nothing, because perhaps our authority comes from legitimacy. And if you don't have credibility, it's very difficult to defend your legitimacy. To all of you listening today from very many countries, the vast majority of you government officials, I invite you to think about these things. We have to understand this definition of integrity, the old definition that says that integrity is to do exactly the same when nobody's watching. It guided me well when I was in government, but it is not an easy task. I also understand that. So people don't trust government leaders. They trust more scientists. They trust more even CEOs. Next, please. And to conclude, I have, I think, just 2 more slides, and thank you for listening to this. You can also understand this crisis of leadership and trust on how people understand in a vertical axis of ethical versus unethical, and a horizontal axis of less competent and more competent. That business is seen as perhaps ethical and competent. NGOs are seen as highly ethical, a little less competent, and government and media are in the quadrant to the left, to the bottom left, where you shouldn't be, where we shouldn't be. We have no credibility. We are seen as less competent and definitely as less ethical. What a pity. Next, please. 64% of people agreed with the following postulate on vaccine hesitancy. Vaccination, the hesitancy remains a major hurdle. People don't want to really take the vaccine. The percentage of people who say that they will take the COVID-19 vaccine within the next year. You see in the vertical bars, people that say that they will take it in the next 6 months, or people that will take it as soon as possible. But the important thing there is the part that you don't see of the bar. Each one of these vertical bars should go up to 100, right? So there is a big percentage in some of those countries that is nowhere there. It means that people basically say, I am not taking the vaccine, or I am still waiting. Next, please. Very good. This is my last slide. This is my boss, our Secretary General, a man that I respect, Mr. Antonio Guterres of Portugal. He says that the best response is one that responds proportionally to immediate threats while protecting human rights and the rule of law. Both are important. And with that, I thank you for your attention. Back to you, Julia. Thank you.
Thank you so much, Mr. Maya. It's really, thank you for sharing your experience with us and your deep insight We appreciate so much every time you talk. We learn a lot about good character in governance and the importance of integrity and accountability to be able to serve others as ourselves. Thank you so much. Our next distinguished speaker is Dr. Francis Collins. Is the director of the National Institute of Health. Dr. Collins was awarded the National Medal of Freedom in 2007, the National Medal of Science in 2009, and was named the 50th winner of the Templeton Prize 2020. Unfortunately, he's not with us live today, but he sent his recordings, and thanks so much as well to Mr. Lindsley for interviewing him and recording this video for us. So we will have the pleasure to listen to both of you, and yeah, I welcome you. Thank you.
It's great to be on here with Dr. Francis Collins from the National Institute of Health. I've known him for a while, and he's a very trusted and reliable person to be able to speak to. Welcome, Francis, to this time here.
Well, Art, my friend, it's great to be able to have a conversation with you as part of this really important gathering of folks virtually in Geneva. Yes. To talk about the effects of COVID-19 on our planet after a pretty intense and frustrating and tragic year, but one that we are starting to see a path forward.
Right. Well, let me just give a little bit more introduction to Dr. Collins. He's now the director of National Institutes of Health. He's been there from 2009 to the present. It's the largest biomedical research organization in the world. He was formerly the head of the Human Genome Project and really distinguished in being first to map the DNA. He also just recently won the Templeton Prize in 2020 and many other things I'm sure I know I could mention, but that's probably enough for now. He's a very trusted person from around the world and a great friend as well. Just want to ask him a few questions to really clarify overall where we are with regard to COVID and what the future might bring, and those questions will really relate to these areas. Just first of all, what's the present situation with COVID, both in the United States and worldwide?
Well, this is unquestionably the worst pandemic that has occurred on the planet in 103 years. It has, in fact, taken a terrible toll on almost every country in the world, spreading very rapidly from its original description in China in January of 2020, or really the month before that. And now, certainly, here as we're moving into the summer of 2021, still very much a serious issue for almost all countries, despite the many efforts that have been made to try to control this using a variety of public health measures. Certainly worldwide, the tragedy is really quite severe. More than 3 million people have lost their lives to COVID-19. More than 150 million people have been infected with this virus. And that's probably a considerable understatement because many of them weren't able to get tested and weren't able to find out exactly what was happening. In the United States, we have been very hard hit, approaching 600,000 deaths just in our country, and a number of cases in the United States, also an astoundingly large number, of about 35 million. We've never had a pandemic like this since 1918, when influenza, in a particularly awful example of how it can spread rapidly and take lives, did so. So this has been a truly sobering experience. It has, in addition to the health issues, created great economic havoc because of the need to do things to try to stop the spread, which has resulted in many instances in businesses having to shut down, some of them never to return. So let's just say this has been an incredibly challenging, tragic 16 months that we've been traveling, and we need to do everything we can to get through on the other side of this and put this behind us, but we're not there yet.
I just did an interview with David Beasley from the UN World Food Program, And he just said that COVID has also led to obviously economic decline and starvation around the world as people have been in the lockdowns and been able to get enough food. All right, what has been the progress on vaccination, both in the US and overseas? I think certainly it's been available more in the US, but the question is availability worldwide. What's the
Yeah.
question there?
Well, there's good news and there's not so good news. The good news is that the scientific effort to develop these vaccines came forward in an almost miraculous way. If you look back at previous vaccine development, we've never had a vaccine produced and made, put through trials to be sure it's safe in less than 5 years. In this instance, it was 11 months from when the identity of SARS-CoV-2, the virus that causes COVID-19, emerged from China, and when those vaccines received emergency use authorization in the United States and shortly afterward in other places. That was astounding. And having been right in the middle of that development of vaccines, I just have to say the way in which scientists dropped everything and figured out how to get rid of a lot of the dead time that normally slows down the process of development and testing was just amazing. And I think that was the good part of this. We got to a point where we have safe and effective vaccines, several of them, much sooner than you would have predicted possible. The not so good news is we have a limitation still in the numbers of doses. I mean, when you're talking about billions of people who need to be immunized, the manufacturing capacity is not able to keep up with that. And so the distribution so far has been inequitable, with rich countries having access, low and middle income countries, very limited access. We are pushing as fast as we can to take care of that, but we are still in a circumstance where many countries have very limited access to vaccines.
Yeah. Well, I also wanted to ask you, I mean, I read a lot on this issue, and I see people that are totally for the vaccine. I see people that are totally against the vaccine. I see people that are in between with all kinds of issues. What would you say is the most number one objection you hear that you would like to address here to taking the vaccine?
I think safety is the main thing people are worried about. What I just said about how rapidly these vaccines were developed, that was critical to try to save lives, but it makes people wonder, wait a minute, did you cut corners here? Do we really know that these vaccines are okay? Again, no corners were cut of any sort in terms of the rigor of the development and the testing, and that data is all publicly accessible. There's a lot of information out there that's not reliable, but if you look at the primary sources, look at CDC's website in the US, for instance, or look at the data on the vaccines that was published in a public database by our FDA, it is amazing when you look at the vaccines, particularly the messenger RNA vaccines, as they're called, from Pfizer and Moderna, 95% effective, and there is no evidence of any serious adverse events. There are short-term effects of a sore arm, maybe feeling feverish and fatigued for a day, but no severe adverse events with those vaccines. And probably about the most rigorous testing that's ever been done. And I know people are also worried about, well, are there delayed severe events that are sort of lurking out there? People are now walking around who had this vaccine a year ago, those in the first early trials, they're fine. So I think if people are sort of waiting to see, is there some other information here about longer term effect? We've waited quite a while, and I think it's incredibly reassuring.
That's great. Thank you for that. Once you've had COVID, how long does natural immunity last? I know I've heard discussed with some doctors that it might be, although we don't know, parallel to SARS and MERS, and which has about a 2-year to 10-year immunity from a natural, the kind of natural immunity. And also I've heard something about the T cell immunity test. But let's stick with, first of all, the immunity, the natural immunity. How long does that last once you've had COVID?
I wish we knew, but of course, this disease has only been around a little more than a year, so we haven't been able to look at the long tail and see how long it is in terms of that immunity protection. We do know that people can get reinfected who've had COVID-19 before. There's a study in Denmark that shows that's happened to quite a few people, so it's not perfect. And those were people who had only been about 6 months out from their initial infection. It turns out the vaccine is able to generate immunity that's probably stronger and longer lasting than the natural illness. That surprises people. That surprised me. I figured, okay, if you're going to generate an immune response, actually getting the disease is probably the best way to do it. The vaccine's actually better, which is why we recommend to people who have had COVID-19 to go ahead and get vaccinated anyway. That'll give you an even stronger ability to be immune going forward.
One of the things that I've heard here and I've read is that Pfizer was saying you might need a booster shot within 6 months. Is the immunity longer lasting than that? What would you say?
Well, I was a little troubled about that statement because in a way, Pfizer, of course, is the person making the vaccine. So they might have been particularly interested in having the need for boosters. I think we don't know. There are basically two reasons why boosters might be necessary. One of them would be that your immunity fades and you need to get it picked back up again, like we do with other illnesses, like your tetanus shot has to be renewed. Or it might be, and this is something that is now getting a lot of attention, that variants in this virus that are slightly different in terms of the shape of their surface proteins emerge, for which the vaccine is not quite as effective. So for instance, there's a variant that originally is identified in South Africa. All of these have names. This is B1351. And it's clear the vaccines are not quite as good against this in terms of preventing any kind of symptoms. They still seem to be incredibly good at preventing severe disease, which is what most people care about. But if there was another variant that's still out there that's even a little bit more resistant to the vaccine, then we might need boosters for that purpose.
Okay, can you give me sort of an idea? Is the 6 months not good, or you think it's longer immunity from the vaccine once you've had the shot?
I think now we can say the vaccine gives you really good immunity for up to 6 months. That's about the best data we've got because it's the longest period we've got for the large number of people who are in the large scale trials. It might be 9 months, it might be 12, but I think we could say it's 6. It's looking good.
Okay, well, what are the most, one of the things people are concerned about are the serious side effects that have sometimes occurred. How often did they occur, and what would you say about that?
The messenger RNA vaccines, Pfizer and Moderna, do not seem to have any of these really severe side effects in spite of now hundreds of millions of people having received those. The vaccines that are built upon a different platform, as we call it, using an adenovirus vector, that would be the Johnson & Johnson vaccine and the AstraZeneca Oxford vaccine. There have been people who get this rare clotting problem, which seems to be in the frequency of maybe 1 in a million people. It can be pretty significant. It needs to be recognized. It can be treated. This resulted in a brief pause in the United States in administration of that Johnson & Johnson vaccine because people wanted to be sure we knew everything about this. But now that has been lifted because the risk of this is so low, kind of like the chance of being struck by lightning next year. And it seemed like this is still a really good deal. And that vaccine, both of those have a real appeal because they can be transmitted across the world without the need for really deep freezers. They can manage in refrigerators just fine. And the Johnson & Johnson vaccine is also just one dose, which has a lot of advantages if you're trying to deliver this in a low resource setting.
You mentioned some of the variants that are out there. In the cases we know, does the vaccine prevent illness, at least in whole or in part, against these variants? So it has some effectiveness. Are there any that it has no effectiveness?
We have yet to see any variant that the vaccine doesn't work against, but we're looking every day. The tragedy that's happening in India right now seems to be associated to another variant called B1617. We need to figure out quickly whether that is one that might evade protection from the vaccine, but I don't think so from the data we've seen so far. It's interesting in the real world, in Qatar, the country Qatar, They've immunized most of the population. They have a lot of these variants. And so they were able to look and say, did the vaccine work? And against severe disease, it worked extremely well, over 90% protection.
Good. I know you've done a lot of work on long COVID, people that have symptoms that persist over time. Can you make some comments about what you've discovered there?
Yeah, Art, this is a troubling part of this troubling pandemic. Most respiratory viruses, like influenza, when you get sick, you could be pretty sick for a week or two, but then you get better. Something like 10 or maybe as many as 30% of people who get COVID don't, after a month or two, seem to be completely recovered. And this can linger on for weeks and weeks with fatigue, with shortness of breath, with something called brain fog, where your cognitive abilities just don't seem to be as sharp as they should be. We are trying to understand what the mechanism is where this virus can cause all of those long-term effects. We don't really know. Here in the US, we're mounting a study of 20,000 or more COVID survivors to try to understand this and figure out how to help those people and how to prevent the long-term consequences. But it's a bit of a mystery. And it's one more reason to get vaccinated so you don't run the risk of getting the disease. Young people, for instance, may think, oh, I don't need that vaccine. If I get COVID, I'm not going to get that sick. It's the old people who really have the problem. Well, young people get long COVID. They get the long-term consequences, and lots of stories of folks like that. Athletes who are now pretty much bedridden and don't know why. So get your vaccination.
Okay, one final question here. How long before the cloud lifts and we can begin to return to normal life? What would you project?
Well, we all want that, don't we? Boy, I'll tell you. It depends, of course, on the degree to which the disease is spreading in your local community and your country. And the degree to which you get there will depend upon vaccinations as well as good public health measures. The worst thing we can do, though, is to ease up too early and then have another surge. And we've seen that happen repeatedly, and we must not make that mistake. If you could get to the point where 75, 80% of the population is immune because of vaccination or natural infection, then something called herd immunity kind of kicks in. And at that point, the virus doesn't have much of a chance of staying very active because there aren't enough people around for it to infect. We're not there in probably any place in the world except maybe Israel. The UK is getting close. The United States is not there yet, hoping to get there by July. Short of that, we're going to have to deal with the fact that this virus is around for a while yet. And the worst thing we could do while running this marathon is to give up early.
Do you have any, I know you can't say for sure, but do you have any projection as to when you would think it would be back to more normal? I know it's hard to say.
Yeah, it will depend
on that.
Yeah, it'll totally depend on which part of the world you're in and what the virus is doing there right now. Again, in my country of the United States, I think by late July, we might be in the point where the number of cases and the number of hospitalizations has dropped way down, and we could kind of start to come back out into the open and even go to indoor restaurants without worrying about it. We're not there yet.
Right.
But if you're in a place that is not so fortunate in terms of having access to vaccines, it's going to be quite a while longer. South America, Africa, India, all of those places, it's a longer term effort. And I know people are fatigued and tired of this whole thing. I am too. But I'm afraid we have to stick together for a while longer to show this virus that we are capable of vanquishing it. It's like a war, except you can't see the particular agent that you're battling against. It's too small. But the way we win wars is by doing it all together. And that's very much what we're called to do now.
Well, thank you. I wish we could talk a lot longer, but we only have a limited time in this interview. And thank you for your valuable time that you've given too. It's been tremendous, the work you've done, the tireless work. I'm sure this period has been exhausting with many, many demands that's there. So thank you so much for all of your work in doing this. And thank you for giving us the time to be on this interview.
It's a pleasure, Art. Nice to chat with you again. We've been friends for a long time, and we're in this together, battling in different ways to try to put this virus behind us. We will get there, but we're just not there quite yet.
All right, thanks.
Thank you so much. Thank you so much, Dr. Collins, for your encouragement, for this wonderful information. I mean, coming from you, it is reassuring. And thank you, Dr. Art, for making this interview for Geneva Institute. We appreciate very much. Thank you. And I just want to encourage you, like Dr. Collins, please get vaccinated if you have access to the vaccination. This is very important. So our next distinguished speaker is Dr. Timo Wakanavalo, and he's NCD Integrated Service, World Health Organization. The focus of Dr. Wakanavalo current work is providing technical guidance and support to member states on integration and strengthening of health systems to deliver on NCD prevention and control services. Today, he will be speaking on the topic of health challenges and responses. Welcome, Dr. Timo. It's a pleasure to have you with us, and thank you for being with us today. And the floor is yours.
Thank you, Medad, and thank you again for the invitation. Can I confirm that you can hear me well?
Yes, perfectly.
Thank you. From one disease to the next, I am going to actually speak about something that we call, there's a deadly interplay between what our colleague from NIH have just talked about into this, which is non-communicable diseases. And I'm just showing here the slide that describes this. There's really four main diseases: heart disease and stroke, diabetes, cancer, chronic lung disease, but they are affected by some very modifiable common risk factors of tobacco use, unhealthy diet, physical inactivity, and harmful use of alcohol. I will explain how this links with the current pandemic as well in the next slide. Let me just say that with the topic that we have, there is not a disease that is more democratic than the non-communicable diseases. And this is why it's probably quite equal to that of COVID-19, except that for COVID-19 spread by a virus, and whereas non-communicable disease is something that really comes on because of a lifestyle that we have gained or we have adopted with, that is affected by the environment we live in, the economy that's there as well. And there's none that has challenged the foundations of public health so profoundly. The reason why some of the countries are suffering at the moment in coping with emergencies like COVID-19, it's because they haven't taken care of non-communicable disease. And it has crippled their health system, shown by this cartoon diagram of how it does affect that. The next slide, you can see how the equity issue comes in as well when you look at the way the non-communicable disease affects population. If we can have the next slide, that it depends on where you live. And so if you're living on the side of Japan, Republic of Korea, and a lot of the developed countries, your risk of actually dying from a major non-communicable disease between that age group is less than 10%. But if you move across to my country in Fiji and others on the other side, you can see how that rises right above. And so the risk is not really, so there's a disparity between the rich and the poor countries, which is where I want to relate to the topic that we have as far as poverty alleviation is concerned. The next slide, I just want to bring some human touches to this, that the economic burden that non-communicable disease brings is quite huge. The guy on the left, if you can see, as a result of these non-communicable diseases, have got bilateral amputations. You can't see the scar, but he's got a bypass as well. He's partially blind, and is now hooked to the dialysis machine, which costs about $300 a session, and he has 3 sessions a week. And you can calculate what toll does that bring to his life and his expenses as a family. The same goes for the women on the picture on the right. And if you can go in to any of the hospitals in developing countries in particular, this rule of 75 to 80% of adults in the services being affected by NCD is quite true. It also brings some very catastrophic expenditures, which is defined as treatment costs exceeding 25% of household income. And you will see that women leave work to be carers, children leave school to care or supplement household incomes. And money spent on some of these risk factors, actually money not spent on other needs. The guy on the top is actually, as you see, is bilateral amputation, partially blind. He's now got an improvised wheelchair, and he's actually sitting at the toll gate begging. And as you put your toll money, you also include a few coins in it. So they become dependent as a result of this. The picture on the bottom is a young kid who I asked, do you go to school? And he says, no. And why? And he's pointing down to his dad, who's got a left-sided stroke. He's got that amputation as well, and he's possibly blind. All effect of a disease that is largely preventable. And I have some statistics there on the catastrophic expenditure and social burden that this disease brings. But if all of that was not enough, then in comes COVID-19 in the next slide. And this is where we really relate, because those with underlying conditions are mainly those with non-communicable disease. And the deadly interplay is that there is higher susceptibility to COVID-19 infection and higher rate of death from people who have NCD. So much that Dr. Tedros, our Director General, says that COVID-19 has preyed on people with NCD, such as cancer, cardiovascular disease, and so on. And it moves on to say that the delays in diagnosis of NCD results in more advanced disease stages, and if it remains untreated, and during the COVID-19 pandemic, even the fear of getting to hospital to be diagnosed, to be treated, has now exacerbated the whole fatality that is resulting. And it's not just because of COVID-19, but because of this interplay that it has with a disease that's going to be with us for a while. There's optimism by our colleague that we'll win this war against the virus, but the non-communicable disease is something that's going to be with us for a while, and it's a worthy effort to try and address it, especially when a large part of it is about prevention. So let me get to some of the solution in the next slide relating to the topic. The solutions do exist, but they are not sufficiently implemented due to lack of capacity in low and middle income countries. So we know what needs to be done. There is the need for government and for politicians to make decisions that will reduce the risk factors for non-communicable disease and contribute to 50 to 60%. And I'll refer to some of those in the next slide. But also, we need to be implementing policies that respond, if you just go back one more slide, respond to the care and the services that they need. So we need to prevent the disease from actually happening, prevent the exposure of our population to the risk factor, but at the same time, we need to manage those that are already affected by this. And the COVID-19 has kind of exacerbated both. So what are these key solutions? In the next slide, you can see what we call the 16 best buys. If you get onto the next slide, these are really cost-effective interventions that if you implement, it will cost less. Yeah, now if you just go back, it will cost less than $100 international for every daily, for every life years gained. So 5 in tobacco, 4 there in salt to salt as part of diet. There's 1 there on physical activity. There's 3 on alcohol, and there's 3 there on cancer, cardiovascular disease, and diabetes. These are policies that if government take up and actually commit to it and resource to be able to address this epidemic, then we are able to push back the tide. And in the event of future crisis or future pandemic, the health system will be better equipped to be able to address this pandemic. And so there's a real call. If you're listening from the different countries, these are things that needs to be implemented in order to curb this epidemic of non-communicable disease and enable the health system to be able to prevent and control a lot of the crisis that we are undergoing at the moment. If you just talk in terms of dollar sign in the next slide, you will see how the health impact and economic returns over the years, if you actually invest in this best buy package per person, in low and middle income countries. That by 2030, you will at the most be having $14.27 return on that investment of $1 in actually implementing the Best Buy package. And in totality, in the next slide, you will see how that figure amounts, that every $1 US invested in this Best Buys to tackle non-communicable disease will yield a return of at least $7 by 2030. So we have the COVID-19 that we've heard about, but we have these underlying conditions that's been with us for some time and will continue to be with us. And it's causing this deadly interplay with COVID-19. And with the economic and social cost, it's really depriving the individuals and the population of their monetary income, but also in terms of their dependence as they become carers, as they become givers in this area. And the key to it, it's largely preventable. And if government takes steps to invest in some of these population-based policies and invest in the health system to manage some of these diseases, we not only will be better ready for the future epidemic, but will also alleviate a lot of the poverty that is striking those, particularly in the low and middle income countries, who are more vulnerable and more exposed because their choices are limited as far as those risk factors are concerned, but also in accessing the health service. So that's the message I wanted just to bring across, that some simple cost-effective measures at population level and also investing in the health system could help curb the epidemic on NCD and in relation to COVID-19 as well, and alleviate our population of the poverty that they are in. Thank you very much for your attention on this.
Dr. Timo, thank you so much for your experience and for enlightening us on the subject. And it's true, I agree with you that COVID-19 didn't arrange things, and it's just going harder and harder for the poorest of the poor. Thank you so much. Well, our next distinguished speaker is Honorable Dr. Freddy Al-Bayadi. Welcome, Dr. Freddy. Thank you for being with us. Dr. Freddy Al-Bayadi, he is a member of the Egyptian Parliament, 2021 session to 2026. He is the founder as well of he's the founder and the CEO of Salam Medical Center in Egypt, a registered non-profit hospital since 1996. He's also a member of the advisory board of GILPP. Thank you so much for being with us. Today, he will speak on the topic of health challenges and responses. Actually, he will present a case study from Egypt, from where we have worked there. And yeah, please, welcome to you, and the floor is yours now.
Hello, everybody. Thank you for inviting me. Thank you, my brother Medhat. It's a pleasure to be with you. Hoping that next year we can meet each other in person instead of the virtual meeting. I'll try to cover in these few minutes the subject of the challenges of COVID-19 in healthcare facilities. I'll present SMC as a case study, but I'm sure that the same challenges are shared in different parts of the world. Next. When the pandemic starts, I remember in late February 2020, they started to say in Egypt that about the pandemic and about the cases. People actually thought that this is something away. They didn't see any patients suffering from COVID. So they were not actually cautious enough. They thought something they are hearing about. But I can't forget the first day I got a phone call. It was an evening, a phone call from the local health office in our area where SMC hospital is. And they told us that it was in April 2020. They told us about the first patient actually was diagnosed in our facility. And unfortunately, this patient, when he came, he didn't have any typical symptoms. He didn't say that he was a contact to a positive COVID patient. And later on, when it was confirmed that he was COVID positive, and they investigated where he visited in the past days. They contacted us and they told us that this patient was at your facility 2 days ago. This day, actually, that night I didn't sleep that night, actually thinking what we should do, what was the best thing we should do for the safety of our staff, for the safety of our patients. Because when I investigated, I found out also that some of the our staff who contacted him, they were not actually cautious enough. So the next day I had a meeting. I canceled the meeting, that I went to sit with our staff to tell them about this patient, and we had the first patient coming to our facility, and it wasn't diagnosed. It was actually mixed feelings of fear, crying. People actually were shocked, didn't know what to do. Some people wanted to quit work. And I tried to assure them and told them we will do whatever we can do just for your safety. And I told them it's a choice. Nobody is forced to continue working and serving the patients. Myself, I choose to be there. I'll continue seeing my patients. I'll continue working. We had to home isolate the staff who contacted this patient for a couple of weeks. But we had to do a lot of things to assure our staff and to make them confident that they can work. Glad that nobody was hurt, and we were able to continue working. All our staff were safe. We had to do some other things to keep facing the challenges. Next, please. I told you that there was a fear of the staff. There was fear of the patients also coming to a hospital, knowing that many COVID patients are starting to be seen at hospital. So patients with other problems were actually scared to come to the hospital for any medical checkup. Next. We also suffered, beside the staff fear, beside the patient's fear, we had a lot of financial challenges. The financial challenges actually were a complex thing, because our resources actually were cut. The people who were supporting our nonprofit, because of the economic situation globally, our resources were cut with a big extent. The cost of the expenses were tripled, if not more than tripled, because we had to buy more safety materials and disinfectants and all this stuff, and disposable stuff we had to use. So the cost and the cost of these things actually went much higher, with much need and their lack in the market. So the cost of the service were much higher, and the need of the patients for financial supports were much more, because many patients actually lost their jobs in the pandemic. So it was a very complex stage of financial challenge. We were asking if we were able to continue our service or not. Next. What we did to manage these challenges actually in SMC, regarding the staff fear, we had regular meetings with them to discuss the way to assure them. We had to increase the number of staff working for infection control, have full-time staff doing this to assure every day that everything is controlled. We are using the best we can do, the best tools to keep the place safe for the staff and for the patients coming. We had to provide the protection tools, or whatever they needed, whatever it takes to buy more protection tools for our staff. We were ready to do this. Next. The same thing for the patients' fear. We were assuring them with posters, with information, providing disposable stuff, so disinfectants, so they make sure that the place is clean, and we're trying to reduce the risk of getting any infection when they come to our facility. We were trying to reduce the crowd as much as possible. Next. For the financial challenges, we had to do some tactics. We had to cut all our expansion projects. We stopped it. So we shift all our budget or our available money was shifted to the service so that we were able to continue. We postponed any non-emergency or unnecessary expenses, and we focused mainly on the services and the safety materials we needed. Next. We also, as an organization, SMC had a vision for the community. Though it's not a big place, it's owned by a local small church, not a rich one, but we were actually thinking how to not only to provide safety to our place, but to providing safety to the community. We had a vision to the community. So we were able, through some friends, some local friends, to provide 1,000 face shields. At the time, they were expensive. Not many people were able to provide these, but we were able to provide 1,000 face shields to the local government hospital staff, to the ambulance staff in the local community. And this initiative by SMC was done last year and was actually greatly appreciated by the healthcare authorities and by the community people, that SMC was actually thinking not only of protecting our facility, but also how to protect the local community. Next. Another initiative, actually, which a very recent thing that we did, we started last week. The government in Egypt actually started the vaccination programs, the vaccine centers. Still, the number of centers and the number of staff providing the vaccination services is much less than needed. So I started to contact the Minister of Health directly, and I said, we have an initiative to provide the churches as centers for vaccination. And we started to negotiate how can we do it, and said we have the places, we have our volunteers that they can help in organizing this, and the churches will be open to all community, regardless of their faith background or their needs. It will be a place that we will organize the healthcare facilities, will bring the vaccine shots, and the church will provide the volunteer team and the place. And so far, we got an approval for over 70 churches all over the nation to be opened as vaccination centers to provide the vaccines to the people who needed this. Next. And these are actually real photos from churches which was taken last week, where they were providing the vaccines later. Next. Thank you so much for your listening.
Thank you, Dr. Freddy. Thank you so much for all what you've done through this crisis and all the work with your team. And actually, you saved lives. So we thank you for saving lives in Egypt by doing all what you did. Thank you so much. We are honored to have you among us today. Thank you. Well, our next presentation, actually, it's a little focus on Global Hope Network International work, and it is being prepared by my colleague and my friend, Mr. Jeff Latza, and he is actually serves as the regional field leader of Central Asia for GHNI, and he is the field strategy coordinator as well. So Mr. Latza is one of the architects of GHNI's development model called Transformational Community Development. This is what we call TCD. Thank you so much for doing that. Thank you. Now, yes, we can watch the video of Mr. Latza. Welcome.
Global Hope Network International focuses on three main things. The first thing is disaster response. The second thing is long-term self-sustainable community development. We call this transformational community development, or TCD. The third thing is transformational leadership development, and we do that through events such as the Geneva Institute for Leadership and Public Policy. Like most NGOs during the Corona crisis, we couldn't do what we had done normally. We couldn't do business as usual. So what happened was our staff automatically switched to disaster response mode. And let me illustrate this through the story of one of our staff, Oleg, in Tajikistan. Before Corona hit, Oleg was working in about 6 villages, but he couldn't travel to these because of travel restrictions within his country. So immediately, Oleg switched to education and prevention. More than once, Oleg heard people say, "You are the only people to come here and tell us how we can protect ourselves from Corona." Then, once late spring came rolling around, we did something to address food security. Oleg started doing what we call faith gardens. Faith is an acronym. It stands for Food Always in the Home. And Oleg helped hundreds of families plant small gardens to provide food for them and their children. Then towards the end of the summer, Oleg wanted to complete a water project in the south. So he traveled south to near the Afghan border. And just as the well was being completed, he came down with Corona. Now, Oleg's situation is a little bit complicated. Oleg is of Korean descent and an Uzbek national. His wife is an ethnic Russian, but they live in Tajikistan. And so Oleg is not a citizen, so he was sent to the foreign hospital and unfortunately received substandard health care. And he was sick with Corona for 2 weeks, but unfortunately he spent another 5 months. He was sort of circling the drain. He almost died because of the poor treatment he received. And when he came back in the spring, he still was a little bit foggy. During one of our early conversations, he's like, "I want to help these people, but I don't know what to do, Jeff." And I said, "Well, Oleg, how about if we do some faith gardens?" He's like, "Yeah, let's do that." So Oleg went back, and this year, most families have elected to do potatoes. They realize that they really need to stock up for the winter in order that they don't starve again next year. But it isn't just Oleg who is helping in Central Asia. For example, Han in Afghanistan. In 2019, he helped 60 families with trees. Last year, he helped over 300 families with faith garden trees, and this year he's helping over 700 families with faith gardens and such. Also in Pakistan, our staff there, Salim, at the beginning of the decade, he said that he'd like to get to 20 new villages, establish work in 20 new villages in the first 5 years. Last year alone, he started in 21 new villages. And it's just not in Central Asia. Global Hope is helping in more than 36 countries around the world, continuing our TCD plan as well as addressing the Corona crisis. But as we look at transformational policies for poverty alleviation and thriving during international crises, it's come at a heavy price. For example, of the 8 national leaders that report directly or indirectly to me, 6 have gotten Corona. These people were motivated by love for the people that they serve and by compassion, wanting to help them. They put their lives on the line to help others. But Global Hope is not unique. There are many other amazing NGOs and entities like the UN and governments that have done so much to save lives. But what Corona has taught us is that you need to have a game plan, like we have TCD, but also you need to have well-trained boots on the ground. And also you need to be flexible to meet whatever comes your way. Thank you.
Thank you very much, Mr. Latza, for all the work you do on the ground with your team. It's really impressive when we see all the numbers of families your team were able to help us through this crisis, COVID crisis. Thank you so much for your presentation. We've been honored. Our next distinguished speaker is a very well-known man. He's Dr. David Beasley. He is Executive Director of the World Food Program. Dr. Beasley is the Nobel Peace Prize winner 2020. He leads the fight against hunger and provides assistance and training to tens of millions of people around the world. Dr. Beasley could not be with us today, but we are going to show a video of his interview with Dr. Art Linsley. Thank you very much, Dr. Art, for interviewing Dr. Beasley for us. And the topic of today would be on the food challenges and responses. So it is over to you. Thank you.
Well, David, thank you for being willing to share with us today. Let me give a quick introduction as to who David is. David's former governor of South Carolina and now executive director for the United Nations World Food Program. Under David's leadership, the World Food Program has just won the Nobel Peace Prize. The World Food Program is the largest humanitarian organization in the world, and I understand its budget has been about, was it 18 or $8.4 billion a year now. Under David's leadership, it's increased that much. David's also a valued friend to Connie and I. So thank you for being on with us, David, and for giving us your very valuable time.
Art, it's great to see you. It really is. Thank you very much for giving us this opportunity.
You bet. It's great to be able to talk to you. When we had lunch back last April, you talked to us about COVID shutdowns and how it hurt the world's economy, leading to increased world hunger. What's the situation now? How many people are on the brink of starvation? Talk to us about that a little bit.
You know, when COVID was just coming on the scene back in early part of the year of 2020, I got a phone call from an old friend, Tony Blair from the UK. And Tony said, David, you travel around the world probably more than anybody and see a comprehensive picture. What do you think? And I said, Tony, what I'm very concerned about is everyone at that time was making decisions, healthcare decisions about COVID in a vacuum, not really appreciating the consequential dynamics. And I said, we've got to be careful. If we're not, the cure will be worse than the disease. We'll end up killing more people from starvation by economic deterioration. So we really have to work a hunger pandemic along with, at the same time, with a COVID pandemic. And the world responded, and we've really dramatically changed the dynamics of how we were working out in the field, so to speak. Now, that was back in March and April, and I spoke to the United Nations Security Council saying that we've really got to be strategic in how we approach these issues around the world. Now, before COVID hit, because of man-made conflict, the hunger rate, I'm talking about the severe hunger rate, those people that are marching towards starvation. The general hunger rate is about 700 million, but those that are marching towards starvation was 80 million when I arrived at the World Food Program 4 years ago. Prior to COVID hitting, the number had gone from 80 to 135 million, driven primarily by man-made conflict, coupled with climate extremes and fragile governance. But since COVID, the number has spiked. And I'm not talking about people going to bed hungry. I'm talking about people that are really don't know where the next meal is and they're marching towards starvation. That number has now gone from 135 million to 270 million people around the world. And we're looking at 36 countries that could potentially have famine this 2021 if we don't get the access and the funds that we need. So it is a very bad situation, Art. And if we don't get the monies we need, we will have mass starvation, destabilization of nations, and mass migration from those nations. So it's a lot cheaper to address the problem early on than wait after the fact.
Well, one of the things you mentioned there too is the number of people that are dying per day of hunger. Do you know what that is and how that's increased?
Well, just to give you an idea, about 9 million people died in the world in 2020. About 1,008,000 or 900,000 died from COVID. And so it's not one versus the other. It just shows you how bad both are. So you do the math, and you're talking about every so many seconds, a person dies on earth from hunger. And you know, the shame about that is that there's so much wealth in the world today. There's $400 trillion worth of wealth in the world today. Not a single child or person should die from hunger. We have a cure for hunger. We have a vaccine against starvation. It's called food. And so we just need people to step up and do what we can to bring some comfort and hope to people around the world, Art.
Well, thank you for that. You've talked a lot too about the relationship between hunger and conflict. Can you unpack that a little bit and tell us what you mean by that?
We were able to get the United Nations Security Council to pass a resolution last year. The Security Council, which many times is divided with Russia, China, and the West, actually came together on this very important issue, saying there's a clear connection between food security and peace and stability. In fact, that was one of the strong and clear messages that came from the Nobel Peace Prize Committee, because they clearly recognized that the work that the United Nations World Food Program was doing out in the field was bringing peace and stability, using food as a weapon of peace, when some try to use it as a weapon of war, or like extremist groups will use it as a weapon of recruitment by denying food. And so what we have learned over the years, and we survey a lot of people, as you can imagine, we are feeding about 100 million people right now as we speak on any given day, week, or month. And we're trying to move those numbers up quite substantially this year because of COVID. But for every 1% increase in hunger, there's a 2% increase in migration. And when you have spike in prices, you'll start seeing destabilization and riots and protests. So it's all interconnected. And so, Art, we know what needs to be done. We just need the political fortitude and the will to get the money to get the food in the places that need it most.
I really like that phrase, food as weapon of peace, that you used. Can you unpack a little bit more, maybe an illustration of food as a weapon of peace?
Well, in many places, for example, when the day that I received the phone call from the Nobel Peace Prize Committee, I was in Niger, and I was out in the field negotiating access in an area where you had ISIS to the south and Al Qaeda to the north, for example. And if extremist groups can deny access to food, then when a mother or father hasn't fed their child in a week or 2 weeks, they have to join the extremist groups. And so we were out in the field negotiating access so that we could get food to people that would not have to join the extremist groups. Because then when as food is not available, they grow their numbers in terms of the militants and extremists. Now, in general areas, and we can show this from place to place to place, because we're in about 83 countries, Art. 80% of our expenditures are in conflict areas, about 60% of the people. And we see a direct connection and correlation between food and peace. And whether it's in the ISIS or Al Qaeda or Boko Haram or Al Shabaab area, or it could be in South Sudan or Syria, and many other places that we're in as we speak. And some entities will use food as a weapon of division, a weapon of war, a weapon of recruitment, violating your fundamental human rights. And so when we're there, and I tell you, I can give you anecdotal evidence, and particularly in the Sahel, when we're there with food programs and school meals programs, mass migration drops off the chart. Teen pregnancy and 12-year-old marriage rates drops off the chart. Recruitment by ISIS or Al Qaeda drops off the chart. It's a lot cheaper for everybody to address it on the front end versus having destabilization and migration. And we've got a lot of statistical analysis because of the way we survey people when they don't have food, what happens, and there's a clear, absolute correlation. You can imagine in your neighborhood, if everybody in your neighborhood didn't have food, what do you think would happen? And you couldn't get to a store to get food. And if one house in the neighborhood had food, what do you think is going to happen? And we're dealing with that right now in Yemen. If Yemen ends up, because of the designation of terrorist organization, and if we can't get food into Yemen, which requires over 90% of all the food that goes, that the people consume in Yemen comes from the outside. So if we can't get food in, imagine if I do have one truck going through a neighborhood and nobody in that neighborhood's had food in 2 weeks. What do you think is going to happen to my truck and my truck driver? It's not going to be a good scene. It's just common sense. And who would have ever thought in 2021 we'd be dealing with issues like this with all the technology and all the wealth? Art, peace is a very elusive thing. You don't appreciate it till you don't have it. And when you think about how much peace has been brought with prosperity around the world, not many people realize that 200 years ago, 95% of the people on earth were in extreme poverty. Extreme poverty. Today, less than 10. So I tell a lot of the young people, be careful. Don't tear down the systems that's helping 90%, sharing more wealth than any time in world history, to help the 10%. What we can't do is neglect that 10%. We need to improve the systems, tweak the systems, enhance the system, and reach that final 10% out there, because they are not experiencing this better way of life. And so peace is critical. If people don't have food, don't have some degree of economic and food stability, you will have conflict. You will not have peace. You will have war. And when you look around the world today, it's heartbreaking, Art, to see what's happening. In fact, the United Nations, and particularly with leadership like Ban Ki-moon, had established sustainable development goals for the whole world. One of them was to end world hunger by 2030. And quite frankly, that's doable. $400 trillion of wealth in the world today with our experience and expertise, but man-made conflict is driving the hunger rate back up when we should be eliminating hunger. My goal when I arrived at the World Food Program was to put the World Food Program out of business because people would no longer need our outside support. I have not yet met a mother out in the field, whether it's a war zone or like Niger or Burkina Faso. I've not met one yet that wanted outside support. They want to take care of their own families. And when we come in and help them and strengthen them, I've had more mothers tell me, Mr. Beasley, I'm no longer taking care of my own family. I'm now helping my whole village. And if I can just grow another acre, I'm going to sell into the marketplace. And that's that entrepreneurial spirit of taking care of your village, helping your neighbor, and into the marketplace. And so that's where we want to be. And peace is critical to that. And it's why we need to build systems with our beneficiaries. We are rehabilitating land, putting in water systems to improve the quality of the community so they can be stabilized and have peace and not be vulnerable to extremist groups and extreme politics.
Thank you so much, and we'll let you go. Congratulations on the Nobel Peace Prize, and thank you for all the tremendous work you're doing.
All right, thank you. It's great to be with all of you, and blessings to you all, and let's build a safer, better, and a good world. We got a lot of work to do this year.
Thank you.
Thank you very much, Your Excellency, for this wonderful interview, because it's just really, it shows like how our world is very vulnerable and became even more vulnerable through this crisis. And thank you, Dr. David Beasley, for making the world less hungry and working hard and tirelessly to provide food for the needy and the least of the world. Thank you so much. Thank you, Dr. Art, for interviewing Dr. Beasley for us. We appreciate it very much. Well, we move to our next distinguished speaker is Professor Terry Dalrymple. He is the founder and coordinator for the Global Chair Network. He is the vice president and co-founder of the Alliance for Transformational Ministry and catalyst for poverty alleviation with Transform World. Professor Dalrymple will speak on the topic of food challenges and responses, and he will present a case study for us today on the Million Village Vision. Thank you very much for being with us, and it's a pleasure to listen to you today again. Please, the floor is yours.
Thank you very much. there are 1.3 billion multidimensionally poor people in our world today, most of them living in rural villages. They're the ones that live without clean water, proper sanitation, food security. They lack access to healthcare, education, and economic opportunity. Even in the best of times, these are the world's most vulnerable. Unfortunately, they were in many cases further harmed by lockdowns and other responses to the pandemic that tended to focus on the cities. Almost every rural poor village is dependent in some way or another on income from migrant workers. Migrant workers are individuals from their communities that go to work in the cities and bring back support to the village. Often these migrant workers were the first to be laid off in the cities, leaving villages economically without a safety net. You may remember some of the scenes reported by of workers swarming out of Delhi, some of them dying along the road trying to walk home. In my responses among the multidimensionally poor in the last 15 months, I've encountered two kinds of suffering people. One, displaced refugees, and the second are marginalized villagers. Or no, let's stay here with this slide. This slide pictures for us, let's go back, I'm sorry. This slide pictures for us the displaced peoples of South Sudan. As of September 2020, there were 2,182,000 refugees. These displaced refugees were already dependent on the World Food Program and others to provide food and basic supplies before the pandemic hit. As you can see at the bottom right corner, 1.3 billion in funding was requested to meet the need of these 2 million refugees, and only 200, a gap of 79% between what was needed and what was available. The next slide, please. The largest number of refugees from South Sudan landed in Uganda, and many of them in a place called Bidi Bidi. This is a visual of the situation there. We had volunteer development workers among the displaced. They were people from South Sudan who were working in their villages before they were displaced. And they went from championing the cause of development in their villages and turned their attention in the refugee camps to champion relief efforts. Next slide, please. The man on the left, Emmanuel, is one such worker. I began to receive email messages from Emmanuel, and on the next slide, I've listed his requests in the order they came to me. He said food rations have been reduced by 30%. We don't have enough food. Then he said many are sleeping without mosquito nets. Then he said we don't have material for roofing. Then he said we're traumatized, hopes are gone. Then he said cases of suicide are rising daily. Then he said marriages are breaking, children are abandoned, and it broke my heart when this one came in. Parents are selling off their own children. Children, especially orphans, are not in school. We need seeds and farming tools for self-reliance. Unfortunately, in my heart, it was very difficult for us to respond to these requests from the outside, and we were not able to get relief to him in time to help. Emmanuel and his family were forced to leave Bidi Bidi and seek refuge with distant family in a nearby city, and just recently went back to South Sudan to work with his own community. Let's go to the next slide. The second kind of suffering I've encountered were not displaced refugees, but marginalized villagers. These villagers suffered increased deprivations because of the lockdowns in the city. We learned some valuable lessons regarding food challenges. And I want to share those with you. One of the lessons learned is this, that one of the lessons learned is that relief often begins long before the crisis hits. If we can go back one slide, please. What you see in this picture is a group of community volunteers organized and trained as part of a transformational community development project. Before the crisis hit, learned to work together, creating solutions to the deprivations that held them back using local resources. And they worked together before the pandemic to solve problems in the areas of water, sanitation, hygiene, infrastructure, education, economic opportunity, and agriculture. When the crisis hit, they requested help with masks and soap. And you can see some of them wearing masks there. Next slide. They also requested seed for planting in anticipation of a coming food shortage. The impressive thing to me was that this was a community, though poor and living day to day, was looking at what was coming and thinking about the future. And so the next, as you can see in the next slide, these volunteers not only survived the pandemic themselves, but they reached out to multiples of neighboring villages to help them as well. And so these are three lessons that I've drawn from these experiences. One is this: vulnerable are those most dependent on outside resources. We see that with refugees. They become completely dependent on outside resources, and when those resources aren't available, they suffer. The second thing that we learned is this: that self-reliant communities that have learned to work together to solve problems using local resources fare better in a crisis. And here's the third lesson that we've drawn from these experiences. The best community-based development programs make communities both productive and resilient. Thank you for allowing me to share.
Thank you so much, Professor Terry. It was really very interesting to see how the Transformational Community Development Program works in the most needy places in our world today still. Thank you so much for what you've done, and it was a pleasure to be listening to you today. Thank you. So our next presentation will be a video on the work of GHNI. And this video will be presented, will present a seed project. And this video is prepared by Dr. Martins Atanda, who is the regional field leader for Africa and GHNI acting CEO. Dr. Atanda loves to engage and coach rural and poor communities on transformation and the journeying out of poverty to sustainable development. It's a pleasure to have you with us today, Dr. Martins. Please, the floor is yours.
Good day.
Good day, everyone.
It's a pleasure to come presenting to you on Pilot Seed Project. Pilot, because it gives the direction of what we want to do. Seed, because it's not capital intensive, it's not big, it's small. It is a transformational community development program that introduces sustainable development to rural and poor communities. Example is a visit to a school in Nigeria. We shared books to help inspire children. Another example is at Mauritania with an irrigation project where we supported the community in laying pipes to River Senegal to get water for their farms. Another example is soap making in Burkina Faso, one-day project teaching women how to make soap. Another example is the dishwasher in Burkina Faso, so that they can keep their dishes away from animals, so the animals don't come polluting it, and so they can improve their health. Another example is these are the Mauritanians who came in appreciation, standing beside River Senegal, where they can now get water to their farm. In Western Kenya, during the corona virus lockdown, the bishop of the diocese and other partners joined, and we raised resources together to have food provided for the people. Nose mask or face mask, whatever name you want to call it. This was corona prevention in Western Kenya. Together with partners, we shared this. And then the hand washing station also to help communities in Kenya.
The poor in rural communities are poor because they have difficulties with mobilization of their local resources. They also have a difficulty with application of their knowledge to engage their problems. They are intelligent, they have wisdom, but there's no coordination in solving their problems. These are the kind of problems that the pilot project seeks to resolve. A seed project is designed to help the community develop a vision for how it can move forward. The people can help themselves to become self-reliant, self-sustainable.
The seed project will help community members to become good stewards of their own resources. So in a seed project is what we use in entering community in the entry phase, so that we can together produce something viable, something visible, and something that will catalyze their enthusiasm for TCD. In a seed project, it's very small scale, not big, like I explained earlier on, and it combines the effort of the community so that we can work together and assisted by the TCD worker.
Some characteristics of successful seed projects are that they are visible. Everybody in the community knows that the project is going on. There's high probability of success. It's usually simple, small scale.
Where you can read some of these other ones, low scale is completed in 1 or 2 days. And here are some examples, like a garbage cleanup, a football game, or a teaching on nutrition, which all of that takes a day. The non-effective seed project is like having a child care center. That will take a couple of days or weeks, or trying to build a latrine. That takes a longer time.
Projects usually depend on their context too, so this calls for research. There must be research to know what project works for what context. There must be participation of the people. When this is done, it results in collaborative efforts, leading to transformation of the community.
Wow, thank you so much. Thank you for listening.
Thank you for your time.
Dr. Martin, thank you so much thank you very much for this presentation. And I know that you're very passionate about TCD programs. And please, to all our attendees, if you have any questions, if you want to start a TCD program in your community, and especially in Africa, please contact Dr. Martins, and I'm sure that he will be able to help you. Thank you so much. Our next distinguished speaker is Dr. Art Linsley. We already saw him twice today interviewing Dr. Collins and Dr. Paisley. So Dr. Art, welcome. Thank you so much for being with us. Dr. Art is the Vice President of the Theological Initiative at the Institute of Faith Work Economics. He is a member of the Executive Committee of GILPP and a Geneva board member as well. He is also author and co-author and editor of many titles. Dr. Linsley will be speaking today on the topic of economic stability. So please, we want to welcome you, and the floor is yours right now. Thank you.
This is Art Linsley coming to you from Washington, D.C. I'm glad to be able to talk to you as part of this Geneva Institute. I'm going to be talking for a very short time, about 10 minutes, on economic stability. And of course, I can only give a couple pieces of the puzzle and maybe give some things that might be helpful or stimulate thought. First of all, we all know about the crisis that's happened. COVID-19 has killed about 3.5 million people worldwide. And in the United States, it's about 600,000 deaths. There have also been the lockdowns that have driven many people out of business. Many small, medium-sized, and even some large businesses have failed. There are about 200,000 businesses that have failed in the United States and about 26% worldwide. There's been much in terms of starvation. 130 some million were in severe predicament with regard to starvation before COVID, and now 270 million are on the brink of starvation. Along with that, that's brought conflict, that's caused destabilization, mass migration, and other problems. So I want to talk about just some principles that might be helpful to think about. First of all, economic freedom leads to flourishing. At the Institute for Faith, Work, and Economics, we have three basic topics. First of all, freedom, then secondly, fulfillment, and third, flourishing. The opposite of freedom is bondage and slavery. The opposite of fulfillment is frustration. The opposite of flourishing is poverty. The more free people are to be able to use their gifts to unfold the potential of the world around them, the more they will be fulfilled. And the more that millions of people are fulfilled, the more flourishing there'll be and the less poverty. There also is the issue and the importance of political, economic, and religious freedom. I believe that a nation cannot flourish without economic, political, and religious freedom. A nation cannot even be stable without political, economic, and religious freedom. It's like a three-legged stool that if one leg is missing, the nation becomes stable or does not really go forward in a good way. I'm just going to pick one of these, economic freedom, to illustrate. Here's where there's plenty of empirical evidence to be able to make a case. We have many years of study of a report called the Economic Freedom of the World Report that's gone on since 1996. The Heritage Economic Freedom Index has also been very helpful. There's a classic picture of North and South Korea at night that shows many lights in South Korea, but only one point of light in the capital of North Korea, in Pyongyang. South Korea is rated as 24th on the Economic Freedom of the World Report, and North Korea is dead last at 178. And so you see the real difference in South Korea being able to pursue economic freedom. Well, what does economic freedom mean? It means that property is protected by an impartial rule of law. There's an importance of free trade. There's the issue that your money remains sound, that government remains small in proportion to the size of the economy. There's an argument that can be made from the numbers that the more economically free societies have a higher income, in fact, 8 times higher income. The poor make 10 times more in more economically free countries. There's also a happiness index. The more free the country, the happier people are. The more free, the the more protected civil rights. The more free, the cleaner the environment. The more free, less infant mortality, less corruption, less child labor, less unemployment. And the people in more free countries live 20 years longer than the less free countries. Certainly, there's a role for government as well as nonprofits, but markets are crucial to this issue. It's interesting that in 1800, 85% of the world was in desperate poverty, defined as $1.25 a day or less. Now the number's been upgraded to $1.90. In 1950, 50% were in extreme poverty. In 1992, 25%. In 2007, 15%. In 2015, 9.6%. In 2020, the projected number was to be 7.9%. But because of COVID, we had a real rise in extreme poverty. about 150 million more people were moved into extreme poverty, about 1.4% more. But before that, Jim Kim from the World Bank said that by 2030 that this kind of extreme poverty will be eliminated. It's certain that 25 countries in 25 years have risen above this standard of extreme poverty. Particularly South Korea, in two generations, has moved from a recipient nation to a donor nation. And now it's almost in the top 10 of donors to the UN World Food Program. But economic freedom can never be separated from the area of virtue or morality. We need to encourage small businesses. In high-income countries, 51% of businesses are small businesses, and 13% are part of the informal economy, where people just go out and do a job for cash. In low-income countries, 16% of the country's economy is in the area of small business, and 49% is in the area of the informal economies. There's this missing middle of small businesses that need to be addressed. And now particularly, we need to focus on it. There are people that are involved with impact investing that have a kind of patient capital that will invest in other countries to really help the businesses to thrive. People like Spring Hill Management, Norfund, Calvert, Small Enterprise Assistance Fund, Transformational Business Network, and others are all helping in significant ways to do things. Above all, don't underestimate the potential of people to rise above their level and to be able to use their gifts to be able to create and innovate. To summarize, we're certainly in a crisis. There's an economic freedom or freedom that leads to flourishing. There's the importance of economic, political, and religious freedom. A nation will not flourish without it. Economic freedom is necessarily undergirded by virtue. We need to encourage small business. And above all, don't underestimate the potential of people. People would have within them the capacity to create and innovate solutions to the situation and the crisis around us. Thank you for this opportunity to speak to you.
Thank you, Dr. Art. It's really very interesting, and thank you very much for sharing all these wonderful thoughts with us. Thank you. Well, our next presentation will be a video on the work of GILPP in one of our regions, and it will be presented by Mr. Sushil Marandi, who is the regional field leader for South Asia with GILPP. Mr. Marandi has a passion for the poor and a strong desire to see them come out of poverty. Well, thank you so much for preparing this video for us, Mr. Marandi. The floor is yours. Thank you.
Today, I'm going to talk to you about sustainable development. And for that, I have selected a project in Khairbari. Khairbari is a small village in the midst of beautiful tea gardens in the north part of West Bengal, India. The tea gardens add to the beauty of those hilly regions. But in Khairbari, nothing was right. No road, no street lights, no proper house, and of course no toilets. Most of the children were out of the school. Someone has truly said, every rise and falls depends on leadership. Building leadership is the key in bringing sustainable development. 4 years back, Sanjay Tigga, our Global Hope Network staff, had hard time working with this community. Families were run by women as men were into drinking. How do you form a committee when men are not at all interested in development? They had come to a conclusion that life cannot be better in their village. Sanjay never gave up. He and his wife kept visiting them and started working with women. Things started changing. More kids started going to school. A girl from the community agreed to help the children in after-school study. Few women started income generation project for additional income. Some insisted their husband to be low-cost toilet. Sanjay encouraged them to apply for cooking gas, and they got very excited when some of them received free cooking gas from the government. Seeing this, men from the community started coming to meet with Sanjay. They started working on building roads, street lights. Sanjay took them to different government officials to talk about their needs. This initiative helped them to join hands with government officials for development like road, street light, and pipelines for water supply. They had never imagined that they can go to those government officials and talk about the need of the community. Today, the men of the community are actively involved in development of their community. Sanjay is very confident that the road to development will not stop even if he is not there to lead.
Thank you. Thank you, Sushil. We appreciate the great effort of these case studies, bringing to us the practical experience in the field. We do have just a few moments for a couple of questions. We had one that was in the chat room that I would like to ask the Honorable Alex Mejia, if he could please respond. The question was, are there any institutions in place ensuring strict adherence to the rule of law and request for human rights? There was also a question of what is the debate between the human rights issue and the requirement or lack of a requirement of a vaccine for COVID. If you could please help us with this question.
Yes, and thank you again. I have to say something. I hope I didn't misrepresent my ideas. The vast majority of government institutions actually follow the law, try to ensure rule of law, and to protect human rights. However, we are talking about the exception here, right? We are all understanding that there are instances and there are places and there are governments. I cannot name anyone because I work for the United Nations and we are extremely respectful our member states. We have to remain neutral. We don't get into a country politics. It's an issue of sovereignty, right? But still, we read the news. So we know that there are cases in which the rule of law is lacking and, of course, human rights are violated. So as I mentioned, and allow me to direct everyone that you just Google these things and you will go immediately to their platforms. The Human Rights Council here in Geneva and particularly the High Commissioner for Human Rights, they are the guardians of this topic around the world. And you can see exactly what organizations are deemed as appropriate or inappropriate. But when it comes to rule of law, and this is an excellent question, that's where we get a little lost, you see, because there is no such an instance in which globally governments or organizations or people are held accountable when they break the law. It is a realm of every member state. Every government has to ensure that the rule of law is there. But there are global indexes. So I will conclude by saying, I invite you to simply go to the internet and try to see these global indexes that measure rule of law. There is surveys and information and investigations and research and so on, and you will have a better idea of what I'm talking about. But again, human rights highly monitored and evaluated, and including imposing no sanctions and penalties. Rule of law, no, an ethereal area. Thank you, Dr. Ray Martinez.
Thank you. Did you have any comments on the debate about whether or not taking a vaccine or not taking a vaccine? What are the parameters, the debates on that with the human rights issues?
Yes, that's a fundamental issue, and apologies for missing that second part. I do have an opinion. I think that we are compelled because of the greater good to take the vaccine. But at the same time, I'm very aware that this is a very personal decision. States and governments cannot interfere with that personal space, with that free will that implies that a person, she or he, will actually make that analysis and say, this is good for me or this is not good for me. But there is this social setting in which we all have to know, and this is a long discussion for decades before the COVID, on people that decide not to take vaccines or that their children are not to take it. And then the question is, what happened with that kid? This is before the COVID, actually goes to school, has 30 classmates, and she or he, this young person, this child actually gets infected with something that was preventable and curable, and that now is too late. So you see, it's a complicated issue again that goes to the personal realm. Everyone has a social obligation because you are all members of society and gregarious, but at the end of the day, it's a personal thing in which governments don't have the authority to impose this. Thank you so much, Kathleen.
Thank you. To Honorable Dr. Freddie and Dr. Timo, would both of you respond to question, what are two key factors revealed by the COVID health crisis that policymakers should focus on and that you feel are essential for health policy in a nation?
May I speak first?
Yes.
Okay. The first thing, actually, I noticed, especially in my country, and I made this actually clear statements in the parliament and with the policymakers, that during this crisis, we found out that the best investment is in research and education and healthcare fundamentals. And we found out that all the other fields of investment where policymakers were putting their resources in, like in tourism and roads and infrastructures, all this actually it stopped. It didn't work with the pandemic and all the crisis. And all the world and everybody's hope was looking for the research or the sciences to find out a treatment, find out a vaccine. So I think this is a lesson that policymakers should learn, that investing and putting a priority for research and for education should be their first choice and their first priority.
Thank you. Dr. Timo? Let's continuing in that, do you see any special legislation or national policy that would address the poorest of the poor and their opportunities for better health care in this process? Did you see anything unique regarding those vulnerable populations, Dr. Freddie?
Can you say this again? Sorry.
Did you see any need for a particular policy that would address the special needs of the most vulnerable, the poorest of the poor?
Sure. Actually, this is this is a category that should be protected, and there are actually some initiatives that need to be more focused on in educating and special healthcare awareness for the poor people, and to the lawmakers and the governments should encourage all the initiatives, especially in the third world countries where the governments are not able to carry on all the load of the healthcare, and they don't actually help the other organizations like non-profit organizations who are trying to share in the healthcare. So they should think of laws and of policies to encourage the non-profit sector, the non-profit organizations to play a role in this category, in taking care of the poor, the poorest of the poor, in healthcare awareness, in supplying healthcare facilities where governments cannot actually take care of these facilities, of these services alone.
Thank you. I would like to go back to the Honorable Mejia. We do want to thank you for partnering with Global Geneva Institute for Leadership and Public Policy. And we did want to know, are there any particular words of advice that you would give to any of our parliamentarians who are listening or other government officials about how they can seek support or integrate more with the work that the UN is doing for the poorest of the poor during times of crisis? Do you have any advice or recommendations at this point to them?
Certainly I do. And in my time in government, I actually received a similar invitation to the one that I'm going to present now. In every country where most of you are, dear colleagues, there is a resident coordinator of the United Nations system, our quote unquote ambassador or representative. The resident coordinator of the United Nations system in your country, in your capital, is the person that actually represents the UN there and coordinates the whole UN system and something that we call the UNCT, the United Nations country team. His or her obligation is to engage with any government official that would like to actually know more about the UN, to engage with the UN, to tackle the resources of the UN, contribute to the work of the UN under something that we call the United Nations Sustainable Development Framework, which is a document normally lasting 4 or 5 years that is signed between your government and the United Nations system. So please contact them, visit them, and you will see plenty of resources that are available, but also that you will be invited to work with the system closely. To conclude, everything that we do, and if you didn't know more about the Agenda 2030, the Sustainable Development Goals, everything that we do in our headquarters in New York, Geneva, Vienna, Nairobi, but also in every single country around the world, is under the aegis of Agenda 2030 for Sustainable Development and the SDGs, the Sustainable Development Goal. If you didn't know much about it, please go to check our websites or everywhere and just put SDGs. And last but not least, make sure to visit if you are interested in learning, in training, in capacity building. We have hundreds, literally hundreds of seminar, workshops, briefings, and so on for free at unitar.org. So please do engage with us. We cannot do it alone. We need you. Thank you, Kathleen.
Great. Thank you so much for providing that information. We do want to thank all of you who have attended today. And I want to say a special thank you to those who brought these case studies. I wish we had time to probe with each of them with what they would like to see in terms of public policy within the nations where they've been working. This is very important for us to understand, again, the role of vision. As I heard the case studies, people without hope indeed perish. Those who have hope have the ability to move forward and begin to find solutions. So for each of you today in leadership, we encourage you to find those case studies that may help you to share stories with one another so that we may all find better opportunities for the poorest of the poor. We also will be providing a link if you'd like to rewatch today's session. And thank you for coming. And I move back now to Medhat. Thank you for doing a great job today moderating, Medhat.
Thank you, Dr. Catlin. It's a pleasure to be working with you today. Thank you so much. Well, I will now move to close the meeting. But before I do that, I would like to thank our distinguished speakers and all participants in this event. I would like also to thank our partner, UNITAR, and the team who worked hard today and the days before to make this event successful. Thank you to Mr. Kesson as well, who helped me a lot with the administration. Well, I want to remind everyone that the event will continue tomorrow at 2 p.m. Geneva time, and that you can send your question like you did today, and we'll be more than happy to answer them. Well, I'm looking forward to see all of you tomorrow, and thank you so much. Have a wonderful rest of the day. Bye. Bye.
Thank you. Bye.